Kenyans will begin contributing to the Social Health Insurance Fund in July 2024 and not the 1st of March 2024, as earlier announced by the Ministry of Health under the new insurance scheme. A household whose income is derived from salaried employment will pay a monthly statutory deduction of 2.7% of the gross salary. Purity Nelima has more on that story.
The government is dealing with the 58-year-old National Insurance Fund, which has been full of corruption and fraud allegations with Social Health Insurance Fund. Days after recommendations made by the public stakeholders affected to incorporate comments from the feedback in national validation in draft exercise held at KICC, the public were given their chance to incorporate their views.
It is critical that the money flows from contributors to share, to providers, to suppliers, because whenever that fails, as is the case now, then quality is compromised, access is compromised.
Our private hospitals are currently suffering from the delayed payments of their claims from NHIF, and would like to request the Transition Committee, the leadership of NHIF and ACHA to fast-track the reconciliation process and payment of the pending bills.
Kenyans will now be mandated to contribute 2.75% of their gross salary to the Shif. The decision was arrived at after the actuaries from both the Ministry of Health and NHIF did an analysis and found disparities in the amount paid by Kenyans. Those earning below 10,000 shillings were contributing 5%, while those earning a million bob were contributing 0.01%. This will essentially scrap the current maximum of 1,700 shillings contribution, exposing employed Kenyans to higher deduction. No contribution will be made for less than 300 shillings.
Our aim as a ministry is to commence registration within the month of March. I think I can now move the target from fast for you people to breathe. But within the first week of March, we have to begin registration. From our regulations, from the Act, this will go on up to June. And thereafter, we intend to begin payments or contributions at the rate of 2.75% with a minimum of 300. And our hope then is that access to these benefits shall begin from the 1st of July.
A household whose income is not derived from the salaried employment shall pay an annual contribution Shif at a rate of 2.75% of household income as determined by the means testing instruments.
For those who will be contributing 300, but that one we are working a paper on it. Compared to the percentage, we might end up paying more than we are expected to pay. But that one, Chair and PS will be producing a very well detailed document on that one, so that after implementation, we don't invite or attract more complaints.
This will allow Kenyans to access a benefit of package which covers critical services and inpatient and outpatient services. Kenyans will be able to access ICU and HDU services, as well as inpatient services such as radiology and chemotherapy. Outpatient services will also include oncology services such as chemotherapy, radiotherapy, as well as mortuary fees.
SHI, that transition committee needs to be more inclusive. And I will not be wrong to say, Madam CS, that the county government is not represented in this committee.
All Kenyans above 18 years will be required to register biometrically with Social Health Authority. Individuals are expected to produce their national identification cards, whereas those below 18 years are expected to use their birth certificates. All persons traveling to Kenya will be required to pay travel health insurance at the point of entry fee. Purity Nelima, Foot and Down News, look at 1 p.m.